Okay, good afternoon, everybody. As you can see, my name is Alexander Leysen. I am the Vice President of Spierziekte Vlaanderen. Spierziekte Vlaanderen is an organization, as you all may know. Belgium is a little bit a difficult country. We have a lot of regions, and one of these regions is Flanders. So we represent about 350 to 400 families, not only CMT patients, to be quite correct. Normally we represent about 20 rare disease muscular diseases. But of course, CMT is the largest group. I myself am a CMT 1A patient and working about 35 years as a volunteer in this organization. Yes, I'm going to talk very shortly about our own mission and then talk a little bit about the global mission for patient organizations. Oh, sorry, went a little bit too fast. Okay, the first, of course, support and education to the patients, but also to the families. There's one thing I want to stress out, that of course we as patients, we are in the middle of the attention. But of course, there is an entire family surrounding this patient who also has questions. What is going to happen with my husband? What's going to happen with our children? So it's very important for patient organization. If they give information, they don't look only at the patient, but also at the family, the friends, and it goes on. In our work, we have, of course, peer support groups. We have 20 very rare diseases, which we bring together to talk with each other and exchange experiences. Sometimes we have very rare diseases. For instance, the Pompe disease, there are only 8 people in Belgium who have that disease. But we have tried to bring them together, and also, of course, at a more international level, but it's very important to bring those people together. Awareness, I think it's been highlighted through these days, that awareness about the disease is very important, but also the advocacy, trying to work that the rights of the people with a disability are respected. And we have to be very honest about that. It's not always going so well in every country. In Belgium, it's more or less okay, but there are a lot of countries where people with a rare disease are not supported the way they could have been supported. And of course, it's also very important to have a community feeling. The first thing we mostly hear when it comes to a new member is saying, it's the first time I meet other patients. I was always thinking I'm alone, but now I see that there are a lot of other people. I'm starting to belong to a community. And that, of course, is very important to those people. Of course, we do events. We participate in events, bringing people together to share experiences. And of course, very important is to collaborate with experts. I think this is the main issue of this conference, that we are partners. We are not just a patient who gives blood or muscle samples, but we are also persons, we are patients, and we want to be involved in all these clinical trials. Also, of course, educational publications and webinars is a way to express what is going on. And like I said, we represent about 20 kinds of special diseases. Now, to highlight a little bit the importance of patients' organizations globally, not only our organization, but in global, the importance of patients' organization. Very important, and that is something we see every day in our organization, trusted information access. Dr. Google is still a big friend to a lot of people. But unfortunately, as you all know, Dr. Google is not the best doctor to find your information. People hear a lot of things, see a lot of things passing on the internet, and then they come to us and say, I read about this, and then we have to say, take care, be very careful with that information. Be very careful with those supplements you're taking or that kind of course you're taking. It's very important for patients' organization that they have a good relations with experts so they can give their members the right information. Of course, emotional support. I think it's very important to understand that being a patient, as in every life, of course, but in our lives more, I think, not every day is a happy day. When you're in pain, your muscles are not doing what you want them to do, it can get some very emotional. The best thing to do, of course, is talk about this with other people who know their pains, who know the differences they are having. Like I said before, advocacy and guidance also very important, but also solidarity. It's very important that we create a community, like I said, where we are a community with patients, but we're also a part of society. In a lot of countries, people with disabilities are considered a special group, not to be considered as a part of society. I think it's very necessary that we keep on working also on that. And equal rights, let's not forget them. For a lot of people, it's a normal thing. For people with a disability, for people with a rare disease, those equal rights are not always so strongly available. So we have to promote accessibility also. To give an example, if you have to organize, I think Vincent will know this, a conference like this to find a building which is completely accessible, has an accessible toilet and all those things, it's not very easy. I said yesterday at the table, when you go to the coast here in Flanders, you have 8 places, 8, at the entire coast, where you can go to a restaurant in a wheelchair and also go to the toilet. Only 8 places. So there's still a lot of work to do about that. And I think that's also a very important thing to act from patient organizations to make the policy makers aware of that there is still a lot of work to do on that. Not only finding the cure. Of course, I'm waiting almost 55 years for a cure. I can still wait a little bit longer, no problem. But also these things are very important. Reducing the stigma. A lot of times when people see people with a disability or people with rare disease, they don't understand. Here in Belgium, there's now a lot of talk about reducing the costs. We have to find 10 billion euros. What is the department they're looking at? The Department of Health, as a first place to find those $10 billion. Of course, we as patients are very afraid of that evolution. Like I said earlier, it's easy to buy an F-35. It's not so easy to support patients with rare diseases, apparently. For me, the choice is very easy. But I think for the policymakers, not that easy. So securing those equal rights, I think, is also a very important task for patient organizations to keep on working on those equal rights. And like I said, don't forget the families. It's not only about the patients, it's about the families. And when we support patients as an organization, we also support the families. It's very, very important. And of course, this has to lead to a more inclusive and empowering environment. Collaboration, I'm not going to talk long about that because that's why we're here. That's why we have been staying here since Friday, at Thursday evening until now, to talk about it. I think other speakers made it very clear that we are willing to collaborate if our voices are heard, if our patient's voice is included in all the tragedy. What are the challenges for patients' organization? I think it's good to talk about it also. It's not one happy family and everything is going well. There are challenges. The challenge you all have here in the room is finding funding. Well, it's the same for us. A lot of organizations struggle to find funding. The government doesn't support every organization with a lot of money. To give an example, our organization receives the huge sum of 6,000 euros a year. That's it. The rest we have to find them ourselves with gifts or other means to find our funding. So it's for us also a very strong struggle. And of course, if you don't have enough money, you can't hire staff. You can't hire experienced people. You have to rely on volunteers. They're very good people, those volunteers, but sometimes you need paid people. And of course, like all you in this room know, there is a large administrative burden to get €1. I think Ingolf and Vincent know for getting money from the European Union is not so very easy, with a lot of paperwork. We have the same challenges. The access to the healthcare. Here in Belgium, we are very glad we have neuromuscular reference center, which there is possibility to multidisciplinary specialized care. But like I talked with Marco, we have 5 of them. In Holland, there's only one place for CMT patients, where you can go to one place and have all science. So it's very difficult. In other countries, it doesn't exist. The availability of specialized people, like in Germany, that's where it depends where you're living, if you have easy access or not. That's of course something which is not normal. And not to forget the financial barriers to treatment. If you're not well insured, some of the treatments are not payable for a lot of people. And like I said, we have to rely on volunteers, but finding volunteers is a difficulty. People have a lot of things to do, and they all want money for it. Money we don't have. So finding volunteers is getting very difficult. Like I said, I'm doing this kind of voluntary work for 35 years. I can see that all those years, it has become more and more difficult to find other people to do this kind of work as a volunteer. So, small conclusions and call to action. The role of patient organizations, I will put it very seriously, take us seriously. We are not just a group of people with a disability, we have a really important role in a lot of things. So take us seriously to make us more inclusive society for people with a neuromuscular disease. The patient's involvement, policymakers, healthcare professionals, the part where the involvement of the patients is very, very important. And last but not least, like I said, funding. Don't look at us as a waste of public money. We see it as an investing in a society open for all people. Thank you very much.
Thank you very much for your story. Are there any questions? Alex, in the front.
Tell me, Alex.
Thank you, Alex, for your wonderful presentation. Two comments regarding the trusted information. I totally agree with you. I think it was one of our specific role, and it will be maybe more and more important in the future because of social networks and many things. There is so many information circulating, and sometimes the patient feel lost, and they are happy to have good answers to their questions. So for that, we have also, for the scientific or medical questions, we have a SAB, a Scientific Advisory Board, and I think it's very useful, and because we are not specialists, and we are not able to answer all the expert questions. Second point, regarding the advocacy, as you showed and as we saw today, there is so many things to do. And we are most of the time volunteers. So we are limited in a way. And when you have limitation, you need to define priorities and to find partners. And I think one of the solution for us for the transversal needs, building accessibility, for example, working with Rare Disease Alliance is very powerful too, because it's a common need. So I would encourage, if you patient organization don't have a Rare Disease Alliance, work with other patient organization, and build this in your country, because it's very inspiring most of the time and very powerful when you are going with many, many diseases, with common needs for changing the policy, you know?
Yep. Thank you for your comment.
Thank you. Are there more questions? Yes, Arabella?
So, first of all, congratulations for the work you are doing. I mean, being president of the European Alliance of Neuromuscular Disorders Associations, I am working with organizations dealing with different neuromuscular conditions, some of them national umbrella organizations, most of them actually. So I know the burden of these diseases, and indeed the challenges are common. And I think it's amazing that countries like Belgium and Netherlands and I must admit, mostly Western Europe and Northern Europe, they are good examples for everyone to follow in a way. But I would also like to recognize the fact that if there weren't the patient organizations and this desire to do something more at European level and create these umbrella organizations, such conferences and such partnerships weren't today. I mean,
yeah, completely.
They would not exist. And I'm happy to see that a lot of these organizations have more and more expert patients, because indeed we have already created so many trainings out there for expert patients. Yeah, maybe in my youth I dreamt to do medical school, of course genetics, but then you know, we are doing our best to learn in order to be able to understand, and of course we did not understand everything that you presented here, but we are so happy. I mean, I can follow my progress since 2019 when I started, and I learned so many things. And please keep in mind that we, leaders of these organizations and we patient representatives, we don't have only one job like you have, you know, just the medical part. We need to know everything. We need to know a little bit of advocacy. We need to know a little bit from medicine, a little bit from, I don't know, a lot, psychology even. So it's a challenging task, and that's why sometimes I say I don't have time to be a patient. At the end of the day, we are patients, and it's so difficult for us. So please do appreciate our efforts, and we are extremely happy of such partnerships. and all these things that are being created. And as I said, even if I started only in 2019, I can see a real progress at European level with EuroNMD, with all these networks that are being built up, and with these better and better collaboration between patient organizations, professionals, policymakers, and all stakeholders. Yeah, so congrats for
Thank you very
everything you're
much.
doing.
Thank you.